Hello everyone, welcome back to Damal Consult Career Academy. If you're preparing for an interview as a clinical support worker, you're in the right place. In today's video, we'll be going over some of the most common clinical support worker interview questions and providing tips on how to answer them effectively. Whether you're new to healthcare or looking to refine your interview skills, this video will help you feel confident and ready. Let's dive in and set you up for success. 1. Can you tell us about yourself and why you're interested in this role? My name is Andrew Thomas, and I have always been passionate about helping others, which led me to pursue a career in healthcare. I have experience as a healthcare support worker, where I developed skills in patient care, effective communication, and teamwork. I find great satisfaction in providing emotional and physical support to individuals during challenging times. What attracts me to this role specifically is the opportunity to contribute directly to patient care within the NHS, an organization known for its commitment to excellence, inclusivity, and putting patients first. I admire the NHS's values, and I believe my compassionate nature, strong work ethic, and ability to remain calm under pressure align well with the responsibilities of a clinical support worker. This role is not just a job for me but a chance to make a positive impact on people's lives while growing my skills within a supportive and professional environment. 2. What do you know about the NHS and its core values? The NHS, or National Health Service, is one of the largest and most respected healthcare systems in the world, providing free healthcare at the point of need to UK residents. It is guided by the principle of ensuring equal access to quality healthcare, regardless of a person's ability to pay. The NHS is built on 6 core values that underpin everything it does. 1. Working together for patients, putting patients at the heart of care, ensuring their needs come first. 2. Respect and dignity, treating everyone with respect, valuing their individuality and needs. 3. Commitment to quality of care, striving for excellence and providing safe, effective, and compassionate care. 4. Compassion, delivering healthcare with empathy, kindness, and understanding. 5. Improving lives, helping individuals and communities to lead healthier lives. 6. Everyone counts, ensuring fairness and inclusion and reducing inequalities in access to healthcare. I believe these values align closely with my own principles. For instance, I am deeply committed to treating everyone with respect and dignity, and I am passionate about delivering high-quality care with compassion. I aim to contribute to the NHS by upholding these values in my role as a clinical support worker. 3. Why do you want to work as a clinical support worker? I want to work as a clinical support worker because I am passionate about making a positive impact on people's lives, particularly during challenging times. This role allows me to provide hands-on care and emotional support to patients, which is something I find incredibly fulfilling. Additionally, I am drawn to the NHS because of its core values, such as compassion, respect, and improving the quality of care for everyone. I believe that my natural empathy, strong communication skills, and commitment to helping others make me well-suited for this position. I also see this role as an opportunity to grow professionally, develop my healthcare skills, and contribute to a team that prioritizes patient-centered care. 4. How do your skills and experiences align with the requirements of this role? My skills and experiences align closely with the requirements of a clinical support worker role. I have a strong background in providing hands-on care and support to individuals, which has helped me develop essential skills such as empathy, patience, and attention to detail. For example, in my previous experience, I assisted with personal care tasks, like bathing, feeding, and mobility support, ensuring that individuals felt respected and comfortable. I am also highly organized and able to prioritize tasks effectively, which is crucial in a fast-paced healthcare environment. For instance, during a particularly busy period, I successfully managed my time to ensure all patients received the care and attention they needed without compromising quality or safety. Furthermore, I am trained in maintaining high standards of hygiene and infection control, which is vital in protecting patients and colleagues. My ability to communicate clearly and work collaboratively within a multidisciplinary team allows me to contribute positively to the overall care of patients. Finally, I am passionate about providing patient-centered care and understand the importance of upholding dignity. confidentiality, and respect for all patients, which aligns perfectly with the NHS values. I am confident that my skills and experiences will enable me to contribute meaningfully to this role. 5. How do you ensure patient dignity and confidentiality in your work? Ensuring patient dignity and confidentiality is a key priority in my work. To protect patient dignity, I always treat individuals with respect and compassion. This includes ensuring patients are fully informed about any procedure or care I am providing privacy during personal care tasks, such as using curtains or closing doors, maintaining a patient-centered approach by actively listening to their needs, preferences, and concerns. When it comes to confidentiality, I strictly adhere to the principles of patient privacy. This involves only sharing patient information with authorized healthcare professionals on a need-to-know basis, avoiding discussions about patients in public spaces or with unauthorized individuals, ensuring that medical records and documents are securely handled, stored, and accessed only by authorized personnel. By following these practices, I help create an environment of trust and professionalism, which is essential for effective patient care. 6. Can you describe a time when you dealt with a challenging patient or situation? In my previous role, I cared for an elderly patient who was resistant to receiving assistance with personal care due to feelings of embarrassment and loss of independence, which made it challenging to provide the care they needed while respecting their dignity. During one of my shifts, the patient refused assistance with bathing, despite it being crucial for their hygiene and comfort. To address this, I approached the patient calmly and empathetically, acknowledging their feelings and explaining why the care was necessary. I emphasized that my goal was to support them, not to take away their independence. I offered them choices, such as deciding the time for their bath, or whether they preferred a sponge bath instead, giving them a sense of control over the situation. I also reassured them of my professionalism and maintained a respectful and discreet demeanor throughout. Eventually, the patient agreed to the care, and over time, we built a rapport that made future interactions much smoother. By demonstrating patience and understanding, I was able to provide the care they needed while preserving their dignity. This experience taught me the importance of empathy, effective communication, and adaptability when dealing with challenging situations. 7. What steps would you take to ensure the safety of a patient during a procedure? Ensuring patient safety is my top priority when assisting with any procedure. There are several important steps I would take to ensure this. 1. Prepare the environment. I would make sure that the procedure area is clean and properly set up with all necessary equipment, following infection control protocols to minimize any risk of infection. This includes checking that the area is well lit and the equipment is functioning and sterile. 2. Patient assessment. Before the procedure begins, I would ensure that the patient's identity is confirmed by checking their wristband or asking them directly, and that I have a clear understanding of their medical history and any allergies they might have. This step is vital to prevent errors and ensure the right patient is receiving the correct procedure. 3. Communication with the team. I would make sure to communicate clearly with the entire healthcare team involved in the procedure, including the patient's condition and any concerns. Clear communication helps avoid misunderstandings and ensures everyone is on the same page about the procedure. 4. Monitor the patient. Throughout the procedure, I would closely monitor the patient's comfort and vital signs, ensuring that they are stable and well supported. If at any point I notice a change in their condition, I would immediately alert the relevant medical staff. 5. Follow protocol. I would adhere to all standard operating procedures, policies, and best practices for the procedure, ensuring that safety measures are followed at all times. 6. Post-procedure care. After the procedure, I would help the patient safely recover, ensuring they are in a comfortable and secure position. I would also assist with any immediate post-procedure care, observing for complications or signs of discomfort, and report back to the clinical team. By following these steps and working collaboratively with the team, I can help ensure that the patient remains safe and well cared for throughout the entire procedure. 8. How do you prioritize tasks when you're under pressure? When I'm under pressure, I stay calm and organized by following a clear system of prioritization. First, I assess the situation and identify tasks that need immediate attention, such as patient care or responding to urgent requests. I prioritize tasks based on their urgency and importance, ensuring patient safety and comfort are always at the top of my list. For example, if I need to assist a nurse with an emergency procedure while also supporting patients with personal care, I would focus on the most critical needs first, such as helping with immediate patient care during a procedure. Once that is handled, I move on to other tasks such as completing routine checks or updating patient records. I also find it helpful to communicate with my team when under pressure to ensure we're all aware of what needs to be done and can support each other effectively. By staying organized, asking for help when necessary, and maintaining clear communication, I can manage my workload effectively even in high-pressure situations. 9. Can you provide an example of when you worked effectively in a team? In my previous role as a healthcare support worker, I worked as part of a multidisciplinary team that included nurses, doctors, and other support staff. One particular instance stands out where we had a patient who required urgent care after a fall. The team needed to work quickly and efficiently to assess the patient and stabilize their condition. I played a key role in assisting the nurses with patient monitoring, ensuring all equipment was in place, and preparing the patient for X-rays. I also communicated effectively with the patient to keep them calm, which helped the nurses focus on their clinical tasks. I followed instructions precisely and kept the team updated on the patient's status. This experience demonstrated the importance of clear communication, mutual respect, and staying calm under pressure. By working together, we were able to ensure the patient received the necessary care in a timely manner. The collaboration within our team made a significant difference in the patient's outcome, and it highlighted how essential teamwork is in a clinical setting. 10. How would you handle a disagreement with a colleague while on duty? If I were to have a disagreement with a colleague while on duty, my first priority would be to stay calm and professional. I would listen carefully to their point of view and make sure I fully understand their perspective before responding. I believe that clear communication is key to resolving any conflict. So I would approach the situation respectfully and express my thoughts in a constructive manner. If the disagreement relates to patient care, I would ensure that we focus on what's best for the patient, keeping their well-being at the center of the conversation. If we're unable to resolve the issue immediately, I would suggest discussing it with a supervisor or team leader to find a solution. Ultimately, my goal would be to maintain a positive and collaborative working environment, while ensuring the delivery of high-quality care to the patients. 11. How do you ensure effective communication within a healthcare team? Effective communication is crucial in a healthcare setting to ensure that patient care is coordinated, safe, and efficient. I ensure effective communication within a healthcare team by 1. Active listening. I make sure to listen carefully to my colleagues and patients to fully understand their concerns and needs. This helps in providing clear and accurate information. 2. Clear and concise information. I strive to share information in a simple, straightforward manner, ensuring everyone involved understands the message. When communicating about patient care, I avoid jargon and speak in terms that everyone can easily follow. 3. Asking questions. If I'm ever unclear about something, I ask clarifying questions to avoid any misunderstandings. It's important to double-check information, especially when it concerns patient care. 4. Using the right channels. I ensure that information is communicated through appropriate channels. Whether it's verbal handover during shift changes, written notes, or electronic health records. I also follow up when necessary to ensure that no important details are overlooked. 5. Team collaboration. I make an effort to regularly engage with other team members, whether it's the doctors, nurses, or other support workers, to stay updated on patient progress and any changes to their care plans. I always try to foster a respectful and supportive environment for team discussions. 6. Nonverbal communication. Sometimes, communication goes beyond words. I ensure my body language is open and approachable, which encourages team members to feel comfortable expressing themselves. By maintaining open and respectful communication, I can contribute to a well-coordinated and effective healthcare team, ensuring that patient care is always the top priority. 12. What does patient-centered care mean to you? Patient-centered care, to me, means providing care that respects and responds to the individual preferences, needs, and values of patients. It's about treating the patient as a whole person, not just focusing on their medical condition. This includes actively listening to their concerns, involving them in decisions about their care, and ensuring their dignity and comfort are maintained throughout the process. For example, if a patient is feeling anxious or uncertain about a procedure, I would take time to explain what will happen, answer any questions they might have, and offer emotional support to make them feel more at ease. In my experience, when patients feel heard and respected, they tend to have better outcomes and a more positive experience with their healthcare. 13. How would you assist a patient who is nervous or anxious about a procedure? When assisting a patient who is nervous or anxious about a procedure, my first priority would be to create a calm and reassuring environment. I would approach the patient with empathy and active listening, giving them the opportunity to express their concerns. It's important to acknowledge their feelings and let them know that it's completely normal to feel anxious. I would then explain the procedure in simple, clear terms, ensuring the patient understands what will happen step by step and answer any questions they may have. Transparency helps to reduce fear by removing the unknown. I would also encourage deep breathing exercises or offer a quiet space if the patient prefers it to help them relax before the procedure. If the patient is still highly anxious, I would communicate with the healthcare team to see if any additional support, such as sedation or a more detailed explanation from the doctor, is required. Throughout, I would maintain a supportive, patient-centered approach, always respecting the patient's dignity and ensuring they feel heard and cared for. 14. Describe a time when you went above and beyond to help a patient. In my previous role as a healthcare support worker, I was assigned to a patient who was feeling particularly anxious about undergoing a medical procedure. The patient was new to the hospital and seemed very nervous, which made them hesitant to ask for help or even express their concerns. I could tell they were feeling quite isolated and unsure of what to expect. To go above and beyond, I took the time to sit with the patient, introduced myself in a calm and reassuring manner, and explained what would happen step by step during their procedure. I also listened to their worries and answered all their questions, no matter how small they seemed. I made sure to reassure them that they were in safe hands and that we would be there to support them throughout. I then checked in with the patient before and after their procedure, making sure they were comfortable and felt cared for. This small act of reassurance made a big difference to the patient's experience, and I was able to see their anxiety ease, which ultimately led to a more positive outcome. I believe that going above and beyond in patient care means not just performing the required tasks, but also taking extra steps to ensure the patient feels heard, valued, and supported in every aspect of their care. 15. How would you handle a situation where a patient refused your help? If a patient refused my help, I would first respect their autonomy and give them the space to explain their reasons for declining assistance. It's important to approach the situation with empathy and listen to their concerns without being dismissive. I would reassure the patient that their well-being is my top priority, and I would offer to assist in any way they feel comfortable. If the patient is still hesitant, I would gently ask if there is someone else they'd prefer to speak with or if there is a specific reason for their refusal, ensuring I remain calm and non-judgmental. If the patient is still resistant, I would report the situation to the appropriate healthcare professional, such as a nurse or doctor, to ensure that the patient's care needs are being met in a way that respects their wishes. In situations like this, it's important to maintain open communication with the patient and the rest of the healthcare team while prioritizing the patient's rights and dignity. 16. What would you do if you noticed a colleague not following proper hygiene practices? If I noticed a colleague not following proper hygiene practices, I would first ensure the situation is addressed in a professional and non-confrontational manner. My first step would be to approach the colleague privately, without making them feel defensive, and calmly remind them of the importance of hygiene in patient care. I would offer a gentle reminder of the correct procedure, ensuring that they are aware of the specific guidelines or policies in place. If the behavior continued despite this, or if it was a more serious concern, I would escalate the matter to a supervisor or manager, as maintaining proper hygiene is essential for patient safety and the overall health of the team. I understand the importance of teamwork in healthcare and the need to handle such issues in a way that protects both patients and colleagues. Ultimately, my goal would be to maintain a high standard of care, ensuring both staff and patients are safe and well supported. 17. If a patient became unresponsive, what steps would you take? If a patient became unresponsive, the first thing I would do is check for any immediate signs of life, including their breathing and pulse. If the patient isn't breathing or has no pulse, I would call for emergency medical assistance immediately, ensuring that the situation is escalated to the appropriate healthcare professionals. While waiting for help, I would begin CPR if trained and appropriate to do so. If the patient is breathing but still unresponsive, I would place them in the recovery position to keep their airways clear and monitor their condition, making sure they're safe until further medical help arrives. Throughout the situation, I would stay calm, maintain clear communication with the rest of the team, and document the incident according to the NHS guidelines, ensuring that all actions taken are recorded accurately. 18. How familiar are you with infection control procedures? I am very familiar with infection control procedures and understand the critical role they play in maintaining patient and staff safety. I have been trained in standard infection control practices, including hand hygiene, wearing appropriate personal protective equipment (PPE), cleaning and disinfecting surfaces, and proper disposal of waste. I always ensure that I follow guidelines to prevent cross-contamination, and I am committed to staying updated on any changes to procedures. In my previous roles, I have adhered to these protocols rigorously and have ensured that I support the healthcare team in maintaining a safe and clean environment for patients and staff. I understand the importance of infection prevention in a healthcare setting and am always vigilant in following the established protocols. 19. What experience do you have with personal care tasks such as bathing or feeding patients? In my previous role as a healthcare support worker, I gained significant experience in assisting with personal care tasks such as bathing, feeding, and dressing patients. I worked with patients who had varying levels of independence and required assistance with activities of daily living. When assisting with bathing, I ensured that the patient's privacy and dignity were maintained at all times by providing appropriate coverage and respecting their preferences. I also made sure the bathroom environment was safe, warm, and free from hazards. I communicated with patients to ensure they felt comfortable and reassured during the process, taking extra care for patients with limited mobility or those recovering from surgery. In terms of feeding, I supported patients who had difficulty eating independently, whether due to mobility issues or medical conditions. I made sure that meals were appropriately prepared according to any dietary restrictions, and I assisted with feeding, making sure the patient was comfortable and supported. I also monitored the patient's nutritional intake and ensured they were hydrated, reporting any concerns to the healthcare team. Overall, my focus in these tasks was always on providing compassionate, patient-centered care, ensuring that the patient's needs were met while preserving their dignity and promoting their independence as much as possible. 20. Have you completed any specific training that prepares you for this role? Yes, I have completed training that I believe has equipped me with the skills and knowledge necessary for this role. I have undertaken training in basic life support, infection control, manual handling, and I have also obtained NVQ Level 3 Diploma in Health and Social Care. Additionally, I have gained hands-on experience in providing patient care, which has given me a deeper understanding of the practical aspects of this role, such as maintaining patient dignity, providing assistance with mobility, and ensuring comfort during treatment. I'm also committed to continuous learning, so I'm always looking for opportunities to expand my skills, especially in areas such as patient safety and care protocols. I am confident that my training, combined with my willingness to learn, will enable me to make a positive contribution to the team. Finally, do you have questions for us? When asked, "Do you have questions for us?" during an interview for a clinical support worker position, it's important to ask thoughtful questions that show your interest in the role and the organization. Here are a few questions you could consider. 1. Can you tell me more about the team I would be working with? 2. What does a typical day look like for a clinical support worker in this role? 3. What opportunities are there for professional development or training in this role? 4. How does the NHS support staff well-being and work-life balance? 5. Can you describe the type of patients or conditions I would primarily be supporting in this role? 6. What are the biggest challenges currently facing the clinical team, and how could I contribute to addressing them? 7. How do you evaluate performance in this role, and how often are performance reviews conducted? 8. Are there opportunities to advance within the NHS in this field? 9. How does the NHS ensure high-quality patient care, and how is this role a part of that effort? 10. What are the next steps in the interview process? Asking insightful questions demonstrates that you've done your research and that you are serious about the role. 10 tips to help you pass your clinical support worker interview. Here are 10 tips to help you pass your clinical support worker interview. 1. Understand the role. Make sure you have a clear understanding of what a clinical support worker does. Review the job description and highlight key responsibilities, such as patient care, assisting nurses and doctors, and maintaining hygiene and safety standards. 2. Know the NHS core values. Familiarize yourself with the NHS values: compassion, respect, dignity, commitment to quality care, and teamwork. And be ready to demonstrate how you embody these in your work. 3. Prepare to talk about patient care. Since the role centers on patient interaction, prepare examples of how you've supported or cared for others in past roles or during your training. Highlight your empathy, communication skills, and understanding of patient dignity. 4. Use the STAR method for answering questions. For competency-based questions, use the STAR technique: situation, task, action, and result to structure your responses. This will help you provide clear, concise answers with real-life examples. 5. Show your teamwork skills. As a clinical support worker, you'll work closely with medical teams. Share examples of times you've worked effectively in a team, whether in previous jobs, volunteering, or during training. 6. Demonstrate your ability to handle stress. Healthcare environments can be fast-paced and stressful. Prepare examples of how you've managed stressful situations in the past, focusing on how you stay calm and prioritize tasks. 7. Highlight your understanding of infection control and safety. Make sure you're familiar with infection control practices and the importance of hygiene and safety in healthcare. Mention any training or experience you have with these practices. 8. Show your willingness to learn. Being open to learning and taking on new tasks is essential. Discuss any relevant courses, training, or certifications you've completed and express your eagerness to continue developing professionally. 9. Ask thoughtful questions. Asking insightful questions about the team, the patient population, or opportunities for growth shows that you're genuinely interested in the position and eager to contribute. 10. Be punctual and professional. Arrive on time, dress professionally, and bring a positive attitude. First impressions count, and showing that you are reliable and professional will set a good tone for the interview. Thank you for watching. I hope these clinical support worker interview questions and answers have given you the confidence and knowledge you need to succeed. Remember, preparation is key, and with the right mindset, you can ace your interview and land the job. Don't forget to like, subscribe, and hit the notification bell for more career tips and advice. Best of luck with your interview, and I'll see you in the next video.